Bones may be classified into four types on the basis of their shape: long bones, short bones, flat bones, and irregular bones. So long bones, short bones, flat bones, irregular bones. For practical purposes, anatomy of typical long bone is only being discussed. Typical structure of a typical long bone. In children, typical long bone such as femur has two ends. They are called as epiphysis. End of a long bone is called as epiphysis. Singular is epiphysis. An intermediate portion, which is called as a shaft, is called as diaphysis. So shaft is diaphysis. Let's see on the diagram. This is epiphysis, the ends of the long bone, end of long bone. The diaphysis is also called as shaft, and this is metaphysis. So the part of shaft which adjoins the epiphysis is called as metaphysis, one next to each epiphysis. So epiphysis and metaphysis. So metaphysis is between the epiphysis and diaphysis. There is a thin plate of growth cartilage, one at each end, separating the epiphysis from the metaphysis, is called as epiphyseal plate. Epiphyseal plate separates epiphysis from the metaphysis. So epiphyseal plate is also called as growth plate. Epiphyseal plate. At maturity, the epiphysis fuses with the metaphysis and the epiphyseal plate is replaced by the bone. Epiphysis fuses with metaphysis. So growth plate or the epiphyseal plate, which is separating the epiphysis and metaphysis, is converted into bone. So they get connected to each other. Next is periosteum. Periosteum has two layers, the fibrous layer and osteogenic layer. So we'll learn more about this later in later videos. The articular ends of the epiphysis are covered with articular cartilage. Let's learn this first. So articular cartilage is present over the epiphysis. The ends of the bone is covered with articular cartilage. Articular cartilage covers the ends of the bone. The rest of the bone is covered with periosteum, which provides the attachment to the tendons, muscle, ligaments. Therefore, we come to know that this part of the bone is covered by periosteum. And this part, the epiphyseal part, is covered by the articular cartilage. Articular cartilage. Okay. So the strands of fibrous tissue connecting the bone to the periosteum are called as Sharpie's fiber. This is most important. Sharpie's fibers connect bone to periosteum. In this diagram, we can see these are the Sharpie's fibers.